Okay, better? So thanks for that that great talk. The three of us are really here to tell a story about how having a sense of unmet needs from the health system really in our own lives has helped us do a redesign of our lives and our careers. This is a story about doctors who are also moms and caregivers, and then who became innovators. So I am Kim Newell Green. I'm married as Kim Green, but I practice as Dr. Newell, and I do some social media stuff, which you can see there. I first want to start to tell a story about how I really began to think about the unmet needs from the healthcare system. When I was in medical school, my mom called me and she said, "Oh, I have this terrible rash all over me. It's so itchy and my joints are swollen and I'm so tired." And in my, just enough information to be scary mind, I was thinking, oh, does she have some chronic rheumatologic condition or cancer? And I was very worried. And I said, well, did you go to the doctor? And she said, yeah, it was horrible. I just don't trust her. But she told me I have hives. And I said, well, that sounds pretty reasonable. And she said, yeah, but the medicine doesn't work. And I said, well, what's the medicine? It's an antihistamine. It doesn't work because I take it and the rash comes back again. And so she was very frustrated and sort of angry, and so she didn't go back to the doctor. And I called her 4 or 5 weeks later, and I said, what's going on? And she said, oh, I'm just miserable. I can't take it anymore. Well, go back to the doctor, Mom. She won't have anything else to add. And I said, yeah, she will. It's been a long time now. So she went back to the doctor, and this time she came back and she called me, oh, Kim, I'm going to commit Harry-Carry. I just can't live like this anymore. And Harry-Carry being her words. And she said, I said, what happened? What did she say? Well, she said, she told me I have chronic urticaria, so chronic hives. And I unpacked it a little bit. And what was upsetting her so much was that the doctor had given her a perfectly appropriate diagnosis. She had chronic urticaria. That's a retrospective diagnosis. She had had urticaria for 6 or 8 weeks at this time, and by diagnosis, once you've had it for 6 weeks, it's a chronic disease. What my mom heard was a prospective diagnosis. So she heard chronic and thinking, this could last forever. This is going to be a really long thing. For the foreseeable future, I'm going to be miserable. And she was really upset by this. Turned out that a couple days later, her allergy testing came back, and she found out that she was very highly allergic to oak. She didn't put things together for a day until she remembered she had bought a cord of wood. It was wintertime, and she was burning this oak wood in her house. So that was why she had the hives. So for me, it was like a perfect doctor detective story. Everything was tied together neatly, and her problem was solved. So, but she still sort of felt frustrated with this experience with this doctor. So fast forward 2 months, and she calls me, how are you doing, Mom? I'm just so itchy today, and my joints are all swollen again today. Well, oh no, maybe the allergy thing was just a red herring. She actually does have some chronic disease. You stopped burning the oak, Mom, and you still have these symptoms? Oh, no. I paid $119 for that cord of wood. I am burning that oak. So something that had been unbearable, she couldn't live with it when she didn't know what was causing it and whether it had an endpoint suddenly became bearable. So it's a story that I can unpack for hours, but really it's a story of sort of unmet needs. She was not, somehow her doctor who gave her an appropriate diagnosis and all the medicines we have wasn't able to understand what she took back from it and really get at what were her deepest fears and concerns. So as I went through medical school, I thought, okay, I'm going to be the doctor that really can meet my patients' fears and concerns. I'm going to ask that question every time. Have I met your deepest fears and concerns? What are your unmet needs? I became a pediatrician and worked my best to do all of that, to teach medical students and residents to do that. I was starting a movement. But, a few years in, I just felt like I was losing my way and my inspiration. I was unsatisfied with some of the tools in my trade, and I was doing this patient by patient, and sometimes it worked and sometimes it didn't, but it just didn't feel like quite enough. I was confused about how to make my mark. So, I needed a spark or a catalyst, and I sought and found some inspiration. A mentor of mine once said this, and so I decided that I needed to take the bull by the horns, and I was going to steer that bus. A mixed metaphor, sorry about that. So I I went out and started by engaging with patients in a really new world, in the blogosphere and Twitter, and that was just mind-blowing. My ability to say the things I said in a way that I thought was impactful from one to many, and then really beginning to understand how patients think and what are they really dealing with once we give them with a diagnosis. I engaged patients in a new world, and then I also engaged friends and colleagues and thought leaders, both in virtual and social networks. I also learned about the design process, and they made it look really have nice little blocks, but to me it just meant a lot of Post-it notes. So I think I probably did go through my daughter's college fund on Post-it notes trying to figure this out. And then I found a lot of inspiration. And a lot of it was through this Medicine X community, from people who are in this room right here. And I'm so honored to be here with a couple of women, and many in this room, who have been models for me. Ultimately, what I've learned from these two women on stage with me and so many others in this room, in this community, is how to engage patients and caregivers, thought leaders inside and outside of medicine to help to build the new tools that's really going to meet those unmet needs. And really, it's put the heart back into my own doctoring. So what am I doing this with this now? I work at Kaiser Permanente in San Francisco as a general pediatrician. And right now I'm really excited because I've been tasked with building an innovation team. What I'm doing is I'm trying to find the mavericks in my own organization, in my medical center, throughout the whole organization, and really help to build institutional knowledge about how to incubate, test, and implement technologies that are aimed at improving the provider experience, just as we've seen they're doing here at Stanford. I also work to help small companies understand how and when and if to navigate the large health system like ours. One thing that I've been doing is working with a company like this one, Kinsights, that's developing a community for parents of patients who have serious things like life-threatening food allergies to help them navigate some of these things that we just don't know as physicians, not living with these things. So we give you a diagnosis. How do you go home and integrate that into your life? And so many times it is this peer-to-peer sort of support network that can do that to help bridge the provider, help to give the provider information that they need to help you get better. One other thing I'm doing is I'm leading the Physician Health and Wellness Group in my medical center, really working to bring joy back to the practice of medicine, because if the physicians providing healthcare are not satisfied with their job, and in fact getting great joy from it, then it's going to be felt in the experience. So we have more than 500 colleagues in my institution, and I'm hoping that they too can doctor with heart. I keep seeking support and inspiration from all of these thought leaders, and so I'm so pleased to be here to hear from Joyce and Lama, who are two pediatrician moms who are also caretakers of kids with medical conditions, and how that experience really ultimately led them down the path to being entrepreneurs and innovators. So Joyce? Oh, Lama.
Hi, I'm Dr. Lema Ramawi, and I'm just here to talk today a little bit about my experience the past few years as a pediatrician, a mom, and an entrepreneur. This is how I started, pediatrician, happily treating my patients and families. When my son, Zuzu, was a month old, we discovered that he had multiple food allergies and intolerances, and I'll be honest with you, making the diagnosis was the easiest part. Going from being the diagnoser to being diagnosed, that was devastating. I can't tell you how many times I was the one who had to tell families that they had this diagnosis, and I would give them that wonderfully simple solution. Avoid the allergen. Now, as a parent with a child with food allergies, it's not that simple a solution. And I had to figure out how to avoid those allergens for myself because I was breastfeeding, and for my son. And it's not that easy to do. So reading ingredient labels, really hard to do, hard to understand. It is, I'm sorry, this hits home, right? There are hidden allergens everywhere, and it's really hard to figure out what foods are safe. Instructing daycare providers and teachers about food preparation and the challenges around it, about medication use. It's hard. It's really hard. And there's a lack of awareness in the general public about food allergies. So just trying to get people to understand that this is a real issue that people are facing and can really hurt people is really difficult. It's not something that people are used to. It took me about 2 months to figure out how to effectively avoid dairy and soy in my diet. And, sorry, no, not yet. In the meantime, more allergies were added to the list, actually. Beef, eggs, butter, potatoes, peaches, plums. Yes, I was just super happy about that. And I thought to myself, oh, not yet. Sorry. I thought to myself, this is ridiculous. There's got to be an easier way to find safe foods, and I can't be the first person who has actually had to do this. And so that was how Tastery was born. I wanted to build a company that made life easier for people. And when I started Tastery, there were a couple of goals that I had in mind. One of them was to reduce that feeling of being overwhelmed. I mean, ideally take it away. That feeling of being overwhelmed when you first get diagnosed. It's pretty life-shattering to realize that your entire lifestyle has to change, your diet, the way you sort of run your life has to change when you have significant food allergies. And one of the other things that I wanted to address was the stress around maintaining that allergy-free lifestyle. And finally, I wanted to bring back discovery. When you have food allergies, you don't take any chances. You pretty much stick to the same old brands that you find, and you don't try anything new because you don't want to get sick. And so I did exactly that. I found a chocolate bar that was dairy and soy-free, and I went religiously to the same market every week to buy it for $6 a pop. I was breastfeeding, so that was my excuse. But after a while, it gets really boring. So what did I do? I basically, Tastery was my solution to the food allergies. Basically put together a monthly box filled with foods that have been pre-screened, verified to be free of those allergens, and we put a different variety together every month so that people get to try new foods. The great news is that our customers love it. We get notes like that I was overwhelmed when I first got diagnosed, and you made life much easier. And my personal favorite is when people tell me that it's like getting a gift every month. And the idea that someone with food allergies can get a gift of food that they trust is safe for them to eat is something, it really means something. So along with discovering new foods and building trust and verifying that those foods are safe, something that was and is important to us is building a community to help people support each other. Because it is really distressing when you feel like you're alone, and it's really helpful and a wonderful feeling, really, to know that there are people around you who've gone through what you are currently going through. So people are just realizing that this is a big, big problem, and as you probably know, the rates are increasing and we don't know why. But it's a big problem and it's a big market. So people are starting to innovate around new foods based on their personal experiences with food allergies. Tools and devices are being developed to measure contamination from the manufacturer level to the consumer level. Companies like Six Sensor Labs are developing allergen-free sensors that consumers can actually take to restaurants, take that little sample of food, put it in, and figure out if this food is safe for them to eat. The community building is really important because it can also be used for warning systems in terms of people communicating quickly when they find out there's a contaminant through quick information release. I can even imagine technology being used to even, adapting your cell phone so your cell phone-based camera can take a picture of that food and give you a printout of what the allergens are using spectroscopy or other technologies. I think there's a lot of potential there. There are people who are focusing on advocacy and education, and of course Dr. Joyce here is focusing on social design thinking around food allergies. There's a lot of potential. I am really grateful as a mom and a pediatrician, for being able to help other moms and families get through this. And I think there is a better way for the more than 50 million people with food allergies and food intolerances to enjoy their lives. I've just touched upon a few. Thank you so much.
Yeah. Joyce is the technologically savvy among us. She actually is going to use the remote mic.
So, can you hear me? Okay. So exciting to see this peanut gallery in the front row. Just wanted to say that. Yeah, exactly. Irony. So I am a doctor's designer. So I am Joyce Lee. I am an associate professor at University of Michigan. I work with patients and families at Mount Children's Hospital in type 1 diabetes, and I guess what I would call myself is, I have this separate virtual online life as doctor's designer, so I'm at Joyce Lee, Joyclee. And this really has been an evolution because of the personal experiences I've had as a mom with kids with food allergies. So, I call myself a designer. I'm not trained as a designer, right? I've never gone to school for design, and I think this is sort of what you think of when you think of medical design, right? So, how could I call myself a designer, right? I'm a pediatric endocrinologist. No one even knows what that means, right? Who spends her days seeing patients in clinic and writing grants and papers that no one is ever going to read, right? But I just want to tell you a little bit about my journey and how I got here. So 2 years ago, I had the great privilege of being on sabbatical, so that's definitely one of the perks of tenure. And I spent the year here at Stanford. And when we got here, so the one thing I want to say is this is a journey because I think our children lead us on that journey, right? As mothers, as parents, right? Like we learn so many things because of what they teach us. So those are my two kids, B and S, and the bottom line is they have severe food allergies. So my son, B, he has been to the ER multiple times. We've had multiple mishaps with daycare, giving him a creamsicle, even though he's allergic to dairy, eggs, and peanuts. And so, despite those mishaps, our kind of situation in Michigan was pretty good in that we had like caregivers who were pretty much on the ball, were trained by our allergists to know how to manage symptoms, know when to give the medications, know how to manage the food. So we got to California, right, and this is the thing that you give you. This is meaningful use, right? This is like, you print this out, and that counts for meaningful use in the EHR system that we live in today, right? And what are you supposed to do with this? Like, how do you explain this? How can you get a caregiver, a daycare professional to really understand what they need to do for your child? So, and Susanna has this great post, she recently posted on, I think, in Wendy's blog, right? But it was just this idea that, like, you are so annoying as a parent, right? Like, especially when you're a physician, right? Because you're trying to give them vital information to make, to save your child's life, but they don't want to hear it because they're too busy, right? And so, we were at Stanford, here we were in Silicon Valley. So I said, let's try something different. I was just getting into sort of this world of social media, trying to think about, what could I do in that world? And, of course, like if you're Silicon Valley, you make a YouTube video, right? That's what you do. So, so this is my son B, and he plays violin, and so I'm a tiger mom, okay? But, okay, I am a lazy tiger mom, right? So I didn't want to make this video myself. I made him make it with me, right? So he was 6 at the time. I scripted it. I gave, we had discussions about what images he could create to sort of support the message, but he narrated it and he illustrated it. So can you show the video? Turn that one off, I guess. Yeah. Is there volume? I hope there's volume.
I am allergic to dairy and nuts. It is. When do you give me an antibiotic? antihistamine when I have a few hives or raging mouth. How do you give me antihistamine? When you put the purple strip on my tongue. When you give me an EpiPen Junior. Blue pill, weak pulse, confused trouble breathing, swollen lips, swollen tongue, hoarse voice, many hives. Or if I have two systems involved like swollen lips and tongue or hives and vomiting or diarrhea. How do you give the EpiPen Junior? Step 1. Take off blue cap. Step 2. No, do not touch the orange tip. You will poke yourself instead of me. Step 3. Push orange tip into thigh muscle. Hold for 10 seconds. Then call 911. Thanks for taking good care of me.
So as you switch back, so I made sure to put that in, so that they would know, so that it would feel really, really bad. I mean, the cuteness of that voice, right, was really important for sort of being the warning to say, do not kill this absolutely adorable child, right? So I was on sabbatical. I came to Medicine X. This is totally a Medicine X story 2 years ago. And gave it to the teachers, actually passed the tour that morning, and it was really cool because they have a video announcement system, so they showed it to the entire school that we were at when we were in Menlo Park, right? All the students and teachers. And then happened to present, to be part of the Idea Design workshop, and we had to show good design, bad design, so Dennis Boyle was kind enough to actually share this as good design to the whole group of participants at the workshop. Met up with Wendy and Susanna, and they, blogged about it, which I was really grateful for. And it was funny because, here Susanna's putting my stuff up against, or B's stuff up against Mike Evans. So I was quite humbled, right? Although she did talk about the regardless of the production value. So in any case, so my son has a blog now, and it's called I Have Food Allergies and Asthma. We ended up making a trilogy. We did a video on ingredients and handling food because one day at daycare they were having him mix cupcakes even though they wouldn't let him eat them. And then so he talks about ingredients being tricky. We talk about the different ingredients, and he ends up kind of in a very stilted way talking about lactalbumin and lactoglobulin, right? All these confusing terms that, he was just learning to read, and it was just really important for him to capture this, I think, is part of his learning process for protecting himself. And then we got back to Michigan, and his asthma was acting up, so we even did an asthma video. So I think it was really funny. He put the little Michigan M there, which kind of cracked me up. But, the branding people would have a problem with this because you're not supposed to malign the M, which is kind of funny. But anyway. But there were other solutions that we needed, and this is again a Medicine X story, right? You need a lo-fi. You got the videos, but how will you get to them, right? So you need something else that you can kind of give to the care provider with the EpiPens, right? And so that was my fail. But then I was I have this really cool name tag. Maybe I should just make one like that, right? And so I ended up doing that, right? I just created one that had all this vital information, like QR codes to the videos, phone numbers, hospital to go to, right? And then, detailed lists of allergens. So one, actually instructions on how to use the EpiPen, but then also really talking about obvious allergens and tricky allergens related to milk, eggs, and peanuts. So a couple of insights that I had was one, design thinking can solve health problems, right? Here I was a mom, and I was just in search for a solution that would explain the vital information that that the caregivers needed to know about to protect my son. So I de facto became a designer, right? Regardless of the production value. Right? Two, Design which leverages mobile technology and social media changes the paradigm of who, what, and how health information is communicated, right? So because of that bandwidth I got from my social media friends, like the video has been viewed over 1,000 times, right? And I think that's really powerful, right? It's reached a much bigger community. And it was this little boy's voice who carried it through, right? And then finally, it was therapeutic, and it really made me feel better that I've empowered myself, I've empowered the teachers, and I've empowered my son to know more and understand all of his food allergies, right? So got back to Michigan, lived through the polar vortex, so this is sort of the colder part of my design journey, but started collaborating kind of more actively with colleagues from Stanford School of Design, so Matt Kenyon and John Marshall in particular, and ended up sort of thinking about how we could translate sort of that individual story into something bigger that could be scaled and that we could share with a much larger community. So this is my plug for Health Design by Us, and really what it is, it's the collaborative innovation network of you guys, like everyone in this community, right? People at Michigan that I work with, and there's 3 goals that we have. One is to empower the patient as expert. Like we know that healthcare is paternalistic. We know that we continually discount the patient voice in medicine, and we sort of lose the opportunity to use that wisdom, create better tools, technologies, and systems, right, to improve care and to improve health. So that's the first objective. The second objective is to think about creating a culture of making in health. So I think some of you may be familiar with the maker movement, but it's this idea that DIY, you can do anything. The tools and technologies are becoming cheaper. They're becoming easier to use, and even the non-technical person can actually use them to build things. So why don't we do that for health, and why don't we use the maker movement as sort of a paradigm for thinking about participatory design in healthcare, right? And then 3, just trying to connect a community, trying to share ideas. I mean, the group from Stanford today, they presented a whole bunch of interesting things about design, right? Like, I'd like to learn from that. I'd like to learn more about that. I'd like to see what tools they use. I'd love to see what resources they have, right? And likewise, as Kim, as you're doing your innovation work, I want to know more about what you've been working on. We, throughout the year, we've been doing a whole bunch of different activities to try and support those 3 missions. So one is, part of it is, it's about culture, right? It's about changing the paradigm, right? Like, I think Larry Chu has just done a fantastic job. Like, the one thing I learned from this conference 3 years ago is that patients are the experts and they should be treated like the VIPs, right? So, there's something as simple as having a workshop, but putting on the name tag expert, right? That's really important because it acknowledges, where the wisdom is coming from, and it really changes, I think, the dynamic of the interaction between people who are trying to design. So we've done some patient-centered workshops as it relates to my kind of role as chair of emerging technologies in pediatrics at Michigan. We've done a Design My Diabetes Solution workshop where we have multidisciplinary folks working for a client, which is a patient, a caregiver with type 1, so that, we could listen, go through the design thinking process and really develop a solution that might be relevant for themselves, for their experience. And that was really kind of modeled after what I learned from the IDEO design workshop, right? We had Jose Gomez-Marquez come and do a Secret Life of DIY Medical Technology, so sort of debunking the myth that like all healthcare technology is black box, right? So made nebulizers out of bicycle pumps, like who knew, right? Debunking this idea that digital pregnancy tests are better than just like the simple strips you can buy through Amazon, right? So sort of again, trying to get people in healthcare, students, staff, faculty, patients, caregivers, this notion that, we can create health. And we also did a hacking diabetes workshop with kids from Mott Children's Hospital. And then we've also done some curricular collaborations. So trying to, think about the fact that technology is really important in all of this. And so we've done sort of like designing apps for kids with diabetes or just designing apps for health through some of the classes that Matt was teaching for his students. And then I think, the other piece that I think is really important is just this idea that we have to bring this into the culture, right? Like this whole idea of patient as expert and making health, it does not exist in the health systems in which we work, right? So, it's really something simple. So we posted this blog, right? And we made this simple tool, right? And I think I think all my colleagues think that I'm like sitting in the waiting room playing with children in crayons, right? But like this to me is something much more symbolic than that, right? This is sort of creating this notion that yes, you as patient, you as caregiver can create something and actually create something better, right? That can transform your health or the health of others, right? So this is he's one of my patients. I gave him some in clinic, right? So Margot is an art and design student, and she's actually creating Insaman, right, which is a game about carbohydrates and the bad pizza man, right? These are diabeticons that came out of one of the workshops that we did, right? So ideated by, kids, caregivers with type 1 who use text messaging to communicate, right, blood sugars during the middle of the day, but but they needed customized ones. They needed ones so that they could have their own language of communication, and without it being sort of this nagging kind of adolescent with mom, like make the communication easier by creating tools that allow you to do that, right? And then what we ended up doing is we also hired a whole bunch of designers this summer from the Art and Design School. We also hired a patient advocate, Trevor Torres. He calls himself the diabetes evangelist, and he really wants speaking gigs, so I just have to promote him. But I pay, we pay both of them salaries, like to work as students, to work for us, for Health Design by Us. And so Jake had done this really interesting comic about utopia, which had sort of like the positives and negatives. And so we paired up with Trevor, and they came up with this really amazing comic book that's about the positives and negatives of diabetes. And it's coming out soon. And we think we're going to be able to publish it actually in a comic book type, like publishing house that's local to Ann Arbor. So we're sort of excited about that. But I mean, just stuff that no medical provider could ever do, right? Like here we are designing materials for, health systems that are just terrible design and terrible insight, right? This is like way better. And then finally, we're totally going over, sorry. We held the first inaugural We Make Health Fest in August of this year in Ann Arbor. And this was sort of our first kind of community gathering, and it was mostly local people, but really sort of, again, trying to say, let's use the maker movement as a great example of integrating patients as co-designers in health, right? So the goals were, 1, to stress that we're all makers of health, right? We're all creators. 2, that technology can help us make health. Do you see the hashtag? You should be using that hashtag, right? That's a hint, okay? And then 3, we need each other to make health, right? It's about bringing a community together. Like no one person can do anything. It's only when we all come together and contribute and share that we really actually get to the next level. We had Jose Gomez Marquez from the We also had John Kostick, who you'll hear about. He's kind of type 1 diabetes dad and hacker who's basically done to make health in type 1 diabetes. And then I just wanted to finish up. So of course, since we were doing the event, I had to make sure that there was an educational opportunity for my son. So for my keynote to introduce the speakers, I had him script and actually present with me for the fest. And so I told him I wanted him to just kind of, talk about this creation that we had made together for the fest. We're kind of really into cardboard these days, so we made this life-size allergic cardboard reaction. But I swear, he came up with the script. I did not feed this to him, okay? And it's just brilliant. So he says, my family built this project. We started with cardboard, and we turned it into a human allergic body, right? So that's like the runny nose coming out of the nostrils, right? That's like the swollen tongue, right? This is the vomiting. They're actually GIFs on my blog, so you can actually see them live if you want to go there. And then, so he wrote, my mom helped me with the ideas, right? My dad helped with the tape, right? My sister helped with the hives, right? You can build this. Think about it first. Try hard. Never give up, right? It takes teamwork and creativity. It's not just you, it's us. I swear he said this spontaneously, okay? Health designed by us, right? So really want to thank all my colleagues, Valerie Castle. I know who you are. Her relative is in the room. But all of my colleagues at Michigan for helping us to support this work. We're actually trying to get more funding to actually support this because we've been sort of bootstrapping this. So I think to sort of promote this culture of innovation and sharing and seeking help as a community. If you wouldn't mind going here to like give your public support so we could put it on our website, we would love for that to happen. And we have a description. We finally have our website up so that you can learn more about the projects that we've been working on. So
the idea of this was, can you guys hear me? This is on. I'm just going to shout, was that this was going to be a panel. I was going to ask these wonderful women questions, but of course Joyce and her enthusiasm has used up your time. You guys are starving. But I just want to say what I love about Joyce, besides the fact that she's one of the funniest women I know, is that she does a beautiful job of celebrating her successes. Like she admitted that she was a super mom on that little thing that she made. But she's very humble in the same time. So that allergy visit went viral. I mean, and this stuff, she's really creating a movement, as is Lama, and that's what we all want to do. We want to create a movement. I mean, more than 230 people came to this first event that she, pulled out of some body part that I said shall remain nameless. And she's just, this is really exciting stuff. This is what we're all here for. So thanks, everyone.